Hey friends, Dr. Charlie Ware here, your leading expert in natural pain management and other chronic diseases. Here today to talk to you about iron overload in sickle cell patients. Iron overload is actually a common occurrence in sickle cell patients, usually because of the fact that of blood transfusions. It can actually happen with other medications as well, such as overtaking pain medications, as well as improper diet too. But let's get to the first reason, the blood transfusions. Blood transfusions are often used as a way to make sure that hemoglobin levels are actually increased or stay at a certain level in sickle cell patients who historically have low hemoglobin rates between 7.5 and 8.2. We want to keep those around there or even higher if possible. And transfusions can actually keep that, but there are side effects. One of them being iron overload. Iron overload is actually really critical because you having too much iron inside your system, you can actually attach the cells to different organs inside the body. By doing that, you can actually cause the body's organs to shut down and actually cause toxicity inside of your body on a whole, systemically, really. The other reason why iron overload is actually harmful is because of the fact that at a certain point you have a too high of iron overload and your body would not be able, it will start to reject, any sort of blood you're taking. So even if you're in desperate need of having a transfusion, you couldn't receive it because now you either have too many antibodies and or the fact that you have too much iron in your system and your blood is going to be rejected regardless. How can we prevent that? First and foremost, we want to make sure that, like I said, one of the reasons is actually, of course, having a healthy diet. Healthy diet really consists of having lean proteins, plenty of fruits and veggies, and also staying hydrated efficiently. Another thing is we can see that taking pain medications can actually increase the risk of having iron overload because of the fact that a lot of these medications are affecting the trace mineral levels inside of your body. It affects your absorption rate of other nutrients as well as keeping some of the heavy metals, which is iron, inside of the bloodstream. The pain medication doesn't allow your body to excrete out extra iron or other heavy metals inside your system out of the kidneys. The kidneys become weighed down because the fact that you're not able to excrete those, the kidneys become laden with different heavy metals as well, causing kidney disease and other kidney infections as well. The third thing is also proper hydration. Proper hydration is not allowing your body to, again, excrete things efficiently, but more importantly, is actually causing your blood to be a lot thicker and heavier and not allowing your body to, again, to transport and transform different heavy metals in and out of the body efficiently as well. Extra sugar inside your system creates inflammation, and if you're drinking a lot of sugary drinks, again, that's causing inflammation to the blood vessel as well as the ureters, which are what excretes out the different things from the kidneys as well. What can you do to prevent all this? Again, hydration is key, and it's king, especially inside of a sickle cell patient. You want to have anywhere between 45 and 70 ounces of water a day. But inside there, you actually want to have good trace minerals to allow your body to be able to fight off a lot of the iron overload. You can also talk to your doctor about different medications you can take to actually prevent the excess amount of iron in your body. Naturally, we found that drinking black tea, which is fermented tea, in high doses, which means like 3 or 4 cups a day, has been shown to actually have an enzyme inside there to actually reduce the amount of iron inside your body. Basically, it prevents your body from uptaking extra iron inside your system, and it rarely allows you to excrete that out your system as well. As well as different things like chlorophyll. Even though chlorophyll is a green substance, it can actually allow your body to, again, attach to that extra amount of iron and help your body excrete it out too. And then what you want to do is take a good trace mineral complex. Why you want to do that? Because again, the body has a balancing act. The more you have, the better trace minerals inside your system, the more they're going to attach to that extra amount of iron in your system and again help excrete it out. All this is due to the fact that you're allowing your body to be as healthy as possible and actually increasing the health of your kidneys. We see a lot of individuals with iron overload actually do have kidney situations, and that's because of the fact that, like I said before, the body is weighing itself down and not allowing the body to excrete that extra iron out of the kidneys themselves. So the healthier your kidneys are, the healthier your body is going to be. But again, the more you can prevent having to take extra pain medication and or having a blood transfusion, the healthier your body is going to be. Again, it's Dr. Charlie Ware, your leading expert in natural pain management and other chronic disease. Take care.